I'll ask you this, like, do you get annoyed with friends and family constantly asking?
I would like to say I don't, but when I come home from school, the first thing that they ask me is, can I have a massage? And I know, like, my mom does a lot for me just because I can't work during school, so I don't mind giving her a massage because, she does help me out. But then my sisters ask, and then my dad asks, and I always ask them, like, when you come home from your job, is the first thing you want to do watch kids? Is the first thing you want to do, do other people's paperwork for doctors? Like, no. Like, you just want to relax. So, yes and no, just because I love them and I want to help them, but yeah. Yeah.
Welcome back to the Sign of Good Health podcast. Today I'm with Katie Petrick, my sister-in-law. She's a recently graduated massage therapist, so we're going to talk about her experience with the schooling and then also just massage therapy in general. So Katie, you want to start with just what got you interested in massage?
I've always had kind of an interest in helping people who are in need of help, just physically. So my original plan was to go into chiropractics, but the more I thought about it, the more I thought 6 years of school is a very long time, and the more I thought about it, I just was kind of losing interest in that. But I was at school, and then my mom heard an ad on the radio, and I kind of just went there, tried it out for a week, absolutely loved it. I had a really good instructor, and she really just helped me fall in love with it.
So tell me about the process of going through school. Like, what does that look like?
So the program's about 5 to 6 months, so a little bit shorter than 6 years. So it's kind of divided out in 2 sections, classwork and then on the floor time. So we had to do classroom hours for about half of the time, actually 3/4 of the time, and then we had to do 75 hours of on-the-floor training. So that's working on general public and actually working hands-on with people, which is what I was most interested in. And then I wasn't a fan of classroom hours all that much, and we actually learned all the muscles in the body in 6 weeks and then tested on them every single week, and that was a little hard. But we had a good instructor, so she really helped us through everything.
Yeah, because with doing the anatomy stuff, like, that's normally like a semester or a year long of school, and cramming that into 6 weeks.
There was points in there where I was like, okay, I might just want to be done, but I'm very glad I pushed out through the end.
Tell us about, like, the different types of massage, and do you have a favorite?
So we learned Swedish first, and then we learned sports medicine, and then we learned aromatherapy, deep tissue, what are the other ones? We're learning a little bit of reflexology right now. But I think just starting out, I think my favorite is a little more of like moderate pressure Swedish massage. Just for right now, because I haven't been in it that long, so I'm kind of still working up the strength to do deep tissue. But I kind of incorporate deep tissue into my Swedish massage if the person needs it. Yeah,
and from my own experience, just with self/friend experimentation and some personal training clients, just if, like, and just so I'm not going out of scope of practice for myself, because I know obviously we'll get to that, but I'll give them a lacrosse ball and tell them to put it here, and then they put pressure on, so I'm not, going outside of that. And that is going to be another question, but so let's talk about, like, with Swedish and then deep tissue, that's where you're putting, like you're saying, moderate to more intense pressure. So let's talk about the difference between good pain versus bad pain.
Right. So you're just able to tell by when you palpate somebody that if their muscles are allowing you to go deeper, then you should, or you can go deeper, but if they're saying, oh, the second you put a tiny bit of pressure on them, they probably won't, accept it while their muscles won't agree with it, and it won't be beneficial to them. So you can almost tell that if somebody's muscles are letting you in more, you can, but if it's kind of like their muscles lock up a little bit, then deep tissue probably isn't a good idea.
Yeah, that's interesting, because, like, and I wonder if when I was working on myself or with people, it's like, because I would tell them, it's going to hurt, but you need to just breathe through it and relax.
Right.
So it's kind of like getting them into that acceptance mindset. Do you think that's important?
Right, yes. And then you have to go into the massage just thinking that one time won't fix everything. One session will not fix everything. And if it did, we'd be out of business very, very quickly.
Right.
But so you just come up with a treatment plan for them to say, we may not get as far as we want this session, but next session we can definitely work more and go deeper if your muscles allow us to.
Yeah, that's really interesting. So, do you deal with, like, have you had people yet that, like, I'll say the phrase have issues, but we're referring to muscle issues, like, but they don't want to feel the pain or deal with, like, kind of push through it?
I think most of the clients that I get accept the fact that it will be a little tender and uncomfortable, but they need to push through it in order to get where they want to be again.
Mm-hmm.
So I haven't had any clients come in and say, like, oh, I don't want to fix this problem. They're always, I know it's going to stink, but we need to get through it in order for me to get back where I was.
Yeah. So I have a friend that he's a chiropractor and a nutritionist, and he talked about just, and this applies to so much, but he said people are ready to change when the pain of change is less than the pain of staying the same. So I'm assuming, like, people are coming to massage because the pain is significant enough. So there's probably that level of acceptance.
Right.
So, because, like, when I was reading about massage to prepare for this, there's some stuff with, like, the lighter pressure that can still do effects. So do you want to talk about, like, you said, like, you did Swedish, so there's doing stuff that affects, like, the lymph and the blood circulation. Do you want to touch on that?
I haven't learned all about it yet because so for massage we have to do continuing education,
Right.
so many hours of it, and lymph drainage is one of the things I want to learn.
Mm-hmm.
So we haven't really gone through all of that. The only draining that we've learned so much is, like, sinuses and
Sure.
stuff. But I would like to talk about it, but I don't know enough on it yet.
Yeah, I guess I wasn't sure what all is in the baseline curriculum, because I'm with my own reading and practice and stuff. I'm sure I'm just, grabbing everything
Right.
all over the place instead of a structured thing. So, yeah. So how does continuing education work? Like, how often do you have to do stuff?
We're required to do 24 hours of it every 2 years, I believe. Or 24 hours every year, and then we have to get that renewed every year. So, a lot of places that you work will pay for it, and sometimes they'll offer it at the place you work, but it's very cool because some places, they have them in different, like, all over the world. So there's one in Hawaii that's coming up.
So yeah, boss, I need to head over there.
And a lot of places will actually pay for it.
Yeah, that's really cool, because I've never had as a personal trainer, I've never had a gym pay for it yet.
Right.
I've been at the more chain gyms instead of the boutique ones.
And you can write it off on taxes and everything and say it was for renewing your license.
So did you learn about, like, chakras and the more spiritual stuff? I mean, you mentioned aromatherapy, which is not all the way
Right.
mystical, but...
We have a girl in our class that is super into it, and I spend a lot of time with her and talk to her a lot, and she does a lot of energy work, so I'm kind of learning through her what everything is about, and in that aspect, but no, we did not cover it. I'm sure we will. It's not something the school can require
Right.
to learn about because
There's
no science behind it.
Yeah, and it's hard because it's like, when I've learned about the nervous system, and I don't know a lot about chakras, but the first thing that stood out to me is, like, they say that the 7 chakras line up with 7 bundles of nerves along your spine and your
Right.
brain. So it's like there's got to be something there, and it's just kind of separating. I believe there's a separation between, like, the real stuff, and there's a lot of woo woo whatever that's so it's hard because you got to find the right
Right.
sources and teachers and whatever. So
It's just sad that we can't learn more about it just because it's not scientifically proven like
Right.
a lot of other massage aspects are.
yeah, well, and I believe that there's got to be stuff. There's like, with science we know this much, and there's
Right.
a ton out there we don't understand yet. So I don't know what to think, and so I mean I'll probably have to reach out to the individual. We don't need to name her. Oh, this is just a left field question.
Okay.
Is animal massage a thing? Because I remember seeing a video on horse yoga a long time ago.
We have not learned anything about it, but we did learn pregnancy massages, and a couple of those things kind of relate with animals. Just making that an easier time for them, just because we can't talk to them. So there's a couple of things in pregnancy massages that you can do on animals just to ease that for them.
Yeah. Well, like I know with animals they have like I don't know if the thunder vest is the real term, but it's just like it's basically it provides pressure for the dog or cat for like a thunderstorm or something, and it just helps keep them calm. So there probably is some kind of thing. We just, neither one of us know about it. So if you know something, reach out. So in the school, do they teach you like the business skills, like that side of it?
Yes, actually, the whole last month and a half, 2 months of school, our teacher requires us to do a business plan, which is everything you could possibly need, want, anything for your business, or to start up your own business. So it's a resume, it's a floor plan, it's a 3-year income projections, it's everything wrapped up into this grade, and it's worth 75% of our grade, so we're all kind of stressing about it right now. But I know that even though it's hard, it'll be very beneficial because I plan on opening up my own business someday. And then our teacher allowed us, or formatted it to just take it right to the bank. So if we wanted to start up our own business, we would have everything we needed to go and start it up that day.
That's really cool, because like with personal training classes and courses and stuff, I feel like that isn't emphasized as much, which is annoying because, I mean, we can talk about too, like just the struggles as a freelancer, like some of your classmates are dealing with that.
I think in a lot of different places in massage businesses today, they are targeted for newcomers, people that are new to it, and think that since we're new that they can put added fees in there and just basically sugarcoat it, and then when we actually start out say, oh, you actually have to pay rent and there's a 15% fee on every massage, which kind of stinks because we kind of get underestimated as undervalued as like young people starting out when they should want us to succeed, but that's not always the case.
Yeah. So yeah, that's got to be frustrating for sure, because it's like you gotta. Well, like the hard thing too is, I'll ask you this: like, do you get annoyed with friends and family constantly asking?
I would like to say I don't, but when I come home from school, the first thing that they ask me is, can I have a massage? And I know, like, my mom does a lot for me just because I can't work during school, so I don't mind giving her a massage because, she does help me out. But then my sisters ask, and then my dad asks, and I always ask them, like, when you come home from your job, is the first thing you want to do watch kids? Is the first thing you want to do, do other people's paperwork for doctors? Like, no. Like, you just want to relax. So yes and no, just because I love them and I want to help them, but yeah. Yeah. Short answer, yes.
Is there something you wish people would know about massage in addition to give me a break after work?
Just the fact that we can't bounce from one massage right to the other. Like, we need at least 15 minutes to gather our thoughts, because massage is more just working with your body. People radiate energy, and sometimes it's not good energy. And I know for me, I kind of feed off of people's energy when we're in the room. So if somebody's just kind of a Debbie Downer, like, I just feel so tired and exhausted after I'm done. But then you get the people that are excited, energized, and they kind of just make it all worth it. And then I feel like I could do 10 more massages during the day.
Right.
So I think what people really need to understand is that it's more than just somebody palpating you. You know, it's people's energy. We want to help, but then if, you know, we're so exhausted from the person in front of you, then it's just not going to be quality work.
Right. Yeah, like I had a masseuse in Granite Falls, Chelsea, that she talked about one needing to kind of wash the aura off from the previous client. So,
Also, massage therapists don't like when you use the word masseuse because it comes with a kind of negative connotation.
Okay.
It's much more than just, have you ever heard the term happy endings? It's kind of associated with that. And
Sure.
I know, but I don't, and that's what one of our things our instructor first taught us, is that if anybody says it, kind of shut them down on it, because it's not what people think anymore. So
Yeah. Yeah, oh, and you want to talk about, like, I'm assuming they really hammer out the ethics when you're in class.
Right. So yeah, you want to believe that people are good in today's age, but we always get prepared for some people that maybe don't have your best interest, and just shutting down conversations that don't need to be said. And you know, our classmates will get clients that had one therapist before and then coming back to a different therapist, and you really have to have just an open mind when it comes to every new person coming onto your table. You know, you can't judge them based off what somebody else might have said about them before. Like, you really have to go into it with an open mind.
Sure. Is there stuff you'd want people to know about, like, should you shower beforehand, or, like, what should someone expect for going into a massage?
Not showering because you might smell, because trust me, we've had plenty of those people, but I had a lady come in that actually took or soaked in a bath before she came. And I was thinking, like, oh, why would she need to do that? But actually her muscles were, like, much easier to manipulate that way, just because they had already been warmed up, and
Sure.
they were just easier to move, almost, and work around her problem areas, which, you know, not everyone coming to a massage will have time to do, but definitely
Right.
if it's the first thing in the morning, do that, because then we can absolutely get in deeper and kind of treat that better.
Yeah, that makes sense. So what kind of stuff is common? I mean, it's obviously going to be different for each client, but what's common for post-massage care? Like, what should the client do?
I always tell my clients to increase their water intake, because that's very important, because getting a massage is actually quite similar to working out. Like, you feel dehydrated and you should hydrate your body, because it's very, very important. I always tell my clients to stretch, just in case, you know, they felt pain that they didn't tell me about, and it's just important to do so. Just make sure everything's moving the way it should, and you should definitely, I give them a couple of stretches to do in between each treatment. That way, if I'm not able to get them in 2 weeks later, they can do stuff on their own, but the important part is making sure they actually do them. So, so when they come back to me, I say, okay, go ahead and do the stretch I was telling you about.
And they're like, what?
And if they have no idea what they're doing, then I know that they haven't been doing them.
Mm-hmm.
So that's very important also.
What do you think separates a good from a bad massage therapist?
At the beginning, I would have said just quality of work, but when you do massage, you have to do it for more than just money. You can't look at it that way. You have to say, I want what's best for this person. I want to do everything I possibly can to help them, and not, oh, it's one massage, I get so and so much money from it. So I would say therapists that actually care, you will get more clientele just for actually, you know, caring for them.
Yeah, that makes sense. Yeah, because it's a very much a healing thing, and, like, I've read about how with massage you're releasing all the pent up stress or whatever emotional stuff you're dealing with on top of the physical bindings, and just people holding emotions in their muscles. So that's just really interesting.
And I've had plenty of people have an emotional release on my table, and, you know, there's tears sometimes, and you just have to work with them. And when people are comfortable around you, they will come back to you, and they will say to everybody that they know that this person's kind, this person actually cares. So I think that's just super important. I'd rather be known as the lady who has few clients that I'm actually helping and not a majority of them that I'm just getting money from. And
Right.
kind of talking about how each muscle kind of has an emotion. We had a lady come in that was talking about Chinese medicine, and I don't know if you've ever read into it.
Not a lot.
And she was saying that each muscle of your body kind of carries something that you might not be like letting go of. So shoulders hurting is kind of thinking that you carry the weight of your world on your shoulders. What was it? Arms, you may not be letting go of something. And when she was going through everything that she was saying kind of correlated to my life, and I was like, okay, maybe this isn't just some random lady talking about something, totally random. Like, it actually made sense, which I think is very cool.
Yeah, and that's reminding me of like, just with the symbolic language and just you're talking about like, so like with dream interpretation and stuff
Right.
too. It's like you gotta kind of think in metaphor with phrases or whatever. So yeah, like I'll have to.
But then again, it's not something, that's always proven, it was just like common in China, like we're not going to interpret it the same way they are, and it's kind of something that you really have to research in because you won't find a lot about it.
Right.
But this lady that came in gave us the name of a book, and I am blanking on what it's called now, but I have it written down in my notebook, so I can definitely give that to you.
Yeah. Is there anything that you were surprised to learn about?
How just complicated the body is. How many muscles there are. Do you know from here to here there's 27 muscles? I had no idea. I didn't realize how complex the body was, how many things it's, responsible for, how many, muscles are responsible for so many actions. Like, I had no idea.
Mm-hmm.
So I think that was very, very interesting in learning, and just how far you can go with massage. Like, it's not just you have to be a massage therapist, like working in a salon, you can open your own business, you can work in a hospital, you can work, at a spa, you can work at a country club, you can work anywhere you want.
Yeah.
You can work on a cruise ship for all, like, there's just so many opportunities that I just had no idea.
Like, when I started experimenting with myofascial release, it was amazing where it's like you work on one thing and then you discover 3 other things and you just need to assume, okay, everything in your body's messed up. So, are there common, in America, there's like low back pain and neck pain from usually desk posture / looking at your phone.
Right. So our teacher actually made us do postural analysis. So we stood in front of grid paper and we kind of mapped out where everybody's body is, not where it's supposed to be. So very common, everybody in our class, one of our hips was lower than the other, and Miss Shane was asking, like, is there a side that you sleep on more? And so a lot of my clients always have lower back pain, and then I always ask them, I say, do you sleep with a pillow in between your knees at night? And they always say no. And then most of them also sleep on their side. So a lot of people don't know that the weight of your one leg is compensating for the other. And then you get a lot of lower back pain in there, and then people don't realize that lower back pain kind of associates with your glutes. And people just have no idea. And then I say, okay, then we're probably going to have to work your glutes. And they're like, what? But it's my lower back that hurts.
Yeah.
So it's just a lot of that.
Is there an area or demographic you like working with?
Anybody who really is in pain, I would say, but it's mostly the geriatrics that need it the most and the people that don't come in the most. Because, young people, they do a lot, but I think the older people really need it and benefit from it more because they're willing to accept the fact that they are in pain and want help to just improve. But I think young people think, I'm young, I don't need to come in, I'm going to be fine, and so it's harder to help them when they don't accept the fact that they want or need help. you know?
Yeah, that's interesting because it's just thinking about like people want pills to solve everything, and like I think there's a lot you can do, like you're saying, like there's a lot you can do with massage. So it's like the massage therapist and chiropractor I was seeing, and I felt like I was almost getting more out of the massage.
So
I mean, not to throw chiropractors under the bus, but
I think people just assume that being on a pill is the only thing that's going to help them. But, like, I had a client the other day, and instead of his mom putting him on 3 different pills, she said maybe the pressure of someone touching him would help. And I didn't even think of it that way. But by the end, at the beginning, he was very, like, ticklish, didn't want to be touched, was so hyper. And then at the end, he was calm, relaxed, and asked his mom if he could come back. And I think I didn't really notice until then how much, like, the touch could help, you know?
yeah.
And chiropractors are good. Massage therapists and chiropractors kind of work more closely with each other now. But chiropractors move bones, they don't move muscles. If you have a problem in your muscle, don't go to your chiropractor. You need to go to a massage therapist. And I don't think people realize how important massage is. I think they see it more as a relaxing factor.
Yeah.
But I think a lot more people need it as a therapeutic option. But people just think, oh, massage, relaxing.
Yeah, like there's this image of, in movies or whatever, it's just the soft, light touch with the candles and whatever. Whereas like when I go to get massage, it's to fix a tight
Right.
muscle from weightlifting or martial arts or whatever. And it's like, I have done this with a lacrosse ball or whatever.
Right.
I'm willing to accept the pain. Like, get in there.
Yeah,
Like,
I think most people just want to go to a massage for fluff and buff is what we call it. Just
yeah, that's...
getting you all pretty and then sending you home. But a majority of my classmates I have want to get in there. They want to get deeper. They want to help you. They don't
just want to caress you.
Right. It's not, oh, and we're done.
Yeah.
You know, it's
like I didn't
this is
do
going to hurt a
anything.
little bit, but it's going to benefit you.
Yeah, well, and your sister, my wife, had to learn the difference with massage when I get it.
Right.
But it's also on me she doesn't always necessarily want that deep tissue work. Sometimes she just wants to feel connected, and took me longer than it should have to kind of accept that.
Right.
So, sorry, Tori. Let's see. Yeah, so the last question I have is just like why people get massages. So there's...
Why people get massages? People get them just to relax, like we've said, and some people want the therapeutic option. Some people are looking for an alternative to pills they're on, you know, just helping with that. And I wish massage was more common. I wish people knew the effects of it were beneficial to them, and that they would think of, you know, alternative options of medicine before just going to the doctor and saying, put me on this pill, like it'll help.
Right.
What was the question?
Well, it was just talking about why people get massages.
Oh, right.
What if you need a minute? Like one thing I get annoyed with, and I hear this story all over the place, like, I was just bending over to tie my shoes and I threw my back out, and it's like, you weren't just, there's so much behind that.
Right, it's not just, this hurts, and this is
just
the only body part of mine that hurts.
Well,
it's like,
it wasn't just a one day, all of it out of nowhere, your
it's
back.
being worked
Yeah.
up for a while, and this pain has probably been there, but you just kind of ignored it because it wasn't as bad as it was when you bent down to tie your shoe.
Right. So, it's just like, and then also, to redeem myself for my wife a little bit, she's sometimes gets headaches and stuff, and I've been able to alleviate those through massage instead of her taking various painkiller things or
Yeah,
whatever.
so there's a lot of muscles that actually correlate with headaches, and a big one is your SCM. It runs right here, so picking this up and kind of scrubbing it back and forth kind of helps a lot with people that have headaches. And like I said, I wish people understood that there was more treatment options than just pills, you know what I mean? So like a simple massage, you know, might help that, and yes, you may feel like pain after, and it might not alleviate everything, but it's still sure is gonna help, you know.
Right. So is there stuff, we'll just say a lay person, let's say the Mr. or the Mrs. asks for a massage or a back rub or whatever, is there stuff the person shouldn't do?
So it's important to note that whenever you do give someone a massage, you never, once you're done with that body part, if you're really going in thought about it, I guess, always flush the blood back to the heart. It's important to do that just because so you don't get tingles wherever you go or wherever you do massage, and then it's actually therapeutic to them. So just remember, once you're done with every body part, flush back towards the heart. And never put any upward pressure on the neck. Always go down, because that will give people an instant headache as well. So whenever you're giving each other a neck massage, always do downward pressure.
Katie's at Massage Envy in Fargo if you want to get...
Come see me.
Yeah. Alright, so anyway, thanks for being on the podcast.
You're welcome. Anytime.